Parole au ministre LeBlanc pour débuter. I will now turn to Minister LeBlanc to begin.
Alors, merci beaucoup, Jean-Sébastien. Bon après-midi, tout le monde. Good afternoon. Today, I'm joined by my colleague, Minister Anita Anand, Doctors Tam and Njoo, and Brigadier-General Brodie. Je voudrais maintenant inviter ma collègue, la ministre Anand, à prendre la parole. Alors, à vous, Anita.
Thank you so much, Dominic, and it's just great to be here with everyone today. I'm going to provide you with a brief update on where we stand regarding the procurement and delivery of COVID-19 vaccines. From the beginning, our government has said that all eligible Canadians will be able to be fully vaccinated by the end of September. Thanks to the groundwork that we laid by signing agreements with a variety of leading manufacturers, we are not only meeting but also exceeding our initial targets. Nous avions dit que nous allions recevoir 6 millions de doses au premier trimestre de l'année et nous en avons reçu 9,5 millions de doses au premier trimestre. Nous avions prévu entre 48 et 50 millions de doses avant la fin du deuxième trimestre. Nous sommes en voie de dépasser nos prévisions les plus élevées de plusieurs centaines de milliers de doses. In the first quarter, we had projected that we would receive 6 million doses, and because of our aggressive negotiations, we accelerated this number and ultimately received 9.5 million doses of COVID-19 vaccines. We had projected between 48 and 50 million doses to arrive by the end of the second quarter, being the end of June, and we are on track to beat the top end of that range by hundreds of thousands of doses. We have delivered 44 million doses to the provinces and territories. As of yesterday, they have administered more than 36 million doses. And according to the latest numbers, 77% of eligible Canadians have received at least one dose of vaccine. À l'heure actuelle, le Canada demeure le premier pays de G7 et du G20 pour le nombre de premières doses administrées. Et chaque jour, de plus en plus de Canadiens reçoivent leur deuxième dose. D'ici la fin du mois de juillet, je peux vous confirmer que nous devrions toujours être en mesure d'avoir reçu environ 68 millions de doses. As it stands, Canada remains first in the G7 and the G20 for the number of first doses administered. And more Canadians are getting their second dose every single day, including, I may add, myself. This morning, I am happy to report that I received my second dose from the vigilant healthcare workers staffing the Halton Regional Vaccination Clinic at the Oakville YMCA. Thank you so much. By the end of July, I can confirm that we remain on track to have received approximately 68 million doses of COVID-19 vaccines. All of this is a result of the Team Canada effort, which we have witnessed from the very beginning of this pandemic. While the end is in sight, we are not there yet, and we must remain vigilant. Vaccine supply chain disruptions, unfortunately, still occur. Case counts are following, but we still need to keep our guard up to ensure that vaccines continue to arrive in Canada. This is the work that my department and I will continue to do every single day, accelerating deliveries and ensuring arrivals of vaccines for Canadians. So let us all continue to exercise caution and follow public health guidance. And if you haven't yet and you are eligible, please get your shot and do your part to conquer COVID. Les vaccins sont ici et nous continuons d'en recevoir. Et si nous ne baissons pas la garde, nous sortirons de cette crise ensemble. The vaccines are here. More and more are on their way. And if we keep up the fight, we will get through this together. Thank you. Megwetch. Merci beaucoup.
Thanks very much, Anita. And we'll now turn to Drs. Tam and then Dr. Njoo. Dr. Tam.
Merci. Bonjour à tous. Nationally, 7-day rolling averages continue to decline. Our current national case count is down to less than 640 new cases reported daily. On average, 988 people with COVID-19 are being treated in our hospitals each day, including 486 in intensive care units, and an average of 14 deaths are being reported daily. But the big news is what's continuing to go up. And this past Sunday, the city of Toronto rose to the top when, as a single vaccination clinic, Torontonians stepped up to break through the Canadian one-day record and fly past the North American record to score a worldwide record of almost 27,000 doses given during a day dubbed #Vaccine Day. People all across the country can take pride in this record because so many have stepped up to get vaccinated and encourage others. This is a winning shot for everyone. And though we still need to get more sleeves up for the first and second doses, keep up with precautions as immunity builds across our communities, and listen up to public health advice for awareness of local COVID-19 risks, more and more of us are asking, when can we hug our loved ones? In particular, grandparents, aunts and uncles are looking for advice for when they can share hugs with the kids in their lives. The answer is, because children under 12 are not eligible for vaccinations yet, there is still a risk they can get infected with COVID-19 and pass the virus on to others. However, if you and everyone else around them are fully vaccinated, the risk is lower. By assessing everyone's risk and comfort levels, you can determine if additional personal preventive practices are needed when hugging or being close in person, such as wearing masks and gathering outdoors. During this time of transition, many people may feel more comfortable continuing with individual precautions, such as mask wearing and physical distancing. Let's continue to support each other by respecting each other's personal risk comfort levels. As well, we should all remember that simple things like frequent hand washing and staying home when we have symptoms also reduce risk of many infectious diseases and continue to be important. So let's keep working it up together to get Canadians protected and vaxxed to the max. Thank you. Merci. Language.
Bonjour à toutes et à tous. À l'échelle nationale, les moyennes mobiles sur 7 jours continuent de baisser. Le nombre moyen de cas déclarés au pays a diminué pour atteindre moins de 640 nouveaux cas par jour. Le nombre moyen de personnes atteintes de la COVID-19 traitées dans nos hôpitaux chaque jour est de 988. De ce nombre, 486 étaient traités dans des unités de soins intensifs et en moyenne, 14 décès ont été déclarés par jour. Mais la grande nouvelle est ce qui continue d'augmenter. Dimanche dernier, la ville de Toronto s'est démarquée alors que dans un même lieu de vaccination, les Torontois ont relevé leurs manches et ont battu le record canadien d'un jour. Ils ont aussi pulvérisé le record nord-américain et établi un record mondial avec près de 27 000 doses inoculées en une journée, surnommé mot-clic Vaccine Day. Les gens de tout le pays peuvent être fiers de ce record, puisque tant de personnes se sont fait vacciner et ont encouragé les autres à le faire. Nous en sommes tous gagnants. Toutefois, plus de personnes doivent relever leurs manches pour obtenir leur première et seconde dose. Il faut continuer d'observer les précautions à mesure que l'immunité s'accroît dans nos collectivités et de suivre des conseils de santé publique en ce qui a trait aux risques liés à la COVID-19 de chaque région. De plus en plus de personnes parmi nous se demandent quand pourrons-nous serrer de nouveau nos proches dans nos bras? En particulier, les grands-parents, les tantes et les oncles cherchent à savoir quand ils pourront donner des câlins à leurs petits-enfants et leurs neveux et nièces. La réponse est, puisque les enfants de moins de 12 ans ne sont pas encore admissibles à la vaccination, il y a encore un risque qu'ils contractent la COVID-19 et transmettent le virus. Toutefois, si toutes les personnes de leur entourage sont entièrement vaccinées, le risque est plus faible. En évaluant le risque et le seuil de tolérance de chacun à celui-ci, vous pouvez déterminer si des mesures de prévention personnelle supplémentaires sont requises, notamment le port de masque ou les rencontres à l'extérieur pour être à proximité d'une autre personne ou pour donner des câlins. Pendant cette période de transition, de nombreuses personnes peuvent être plus à l'aise de continuer à prendre des précautions individuelles comme le port de masque et la distanciation physique. Continuons de nous soutenir mutuellement et en respectant le seuil de tolérance au risque de chacun. De plus, n'oublions pas que des simples gestes comme le lavage fréquent des mains et le fait de rester à la maison, si nous présentons des symptômes, réduisent également le risque lié à de nombreuses maladies infectieuses. Ce sont toujours importants. Alors, continuons de travailler ensemble pour protéger les Canadiens et faire en sorte que le plus grand nombre possible d'entre eux soient vaccinés. Merci. Thank you. Miigwech. Go Habs go.
Thank you very much, Dr. Njoo and Dr. Tam. We'll now turn to Brigadier-General Brodie.
Over the past 7 months, we have delivered nearly 45 million COVID-19 vaccines across the nation, first in smaller numbers, and now in substantial volumes on a weekly basis. By the end of this week, we will have brought in 50 million doses to immunize Canadians. This includes provincial allocations currently managed in central inventory by the Public Health Agency of Canada, ready to be called forward to support vaccination strategies at the time and place of provinces' choosing. This inventory management approach allows us to minimize wastage while ensuring that we can continue to vaccinate as many people in Canada as quickly as possible with both first and second doses. This week's distribution of 2.4 million doses of Pfizer-BioNTech is well underway, with close to 2 million of those doses already delivered to vaccine delivery sites across the provinces. Moderna deliveries, carrying over from last week's allocations, are also ongoing. This week's allocation of 1.4 million doses arrived today for delivery late this week and into next week. Moving forward, we are still tracking allocations of Pfizer-BioNTech in July, totaling 9.1 million doses, and we are working with Moderna to confirm upcoming delivery schedules for the balance of July's allocation. We are not done yet. We are carefully monitoring upcoming supply to ensure that Canadians have the doses required to maximize vaccination rates across all eligible populations. D'abord, en plus petit nombre et maintenant en quantité importante chaque semaine, nous avons, au cours des 7 derniers mois, livré environ 45 millions de doses de vaccins contre le COVID-19 partout au pays. D'ici la fin de cette semaine, nous aurons amené 50 millions de doses pour l'immunisation des Canadiens et Canadiennes. Ce nombre comprend les allocations aux provinces actuellement gérées en tant qu'intervenants centralisés par l'Agence de la santé publique du Canada, prêtes à être achemées pour appuyer les stratégies de vaccination des provinces au moment et à l'endroit qui leur conviennent. Cette approche de gestion de l'inventaire nous permet de réduire le gaspillage tout en nous assurant de vacciner avec la première et la seconde dose le plus grand nombre possible de personnes au Canada et le plus rapidement possible. Cette semaine, la distribution des 2,4 millions de doses de Pfizer-BioNTech est bien amorcée. 2 millions de ces doses ont déjà été livrés et des sites de livraison de vaccins dans les différentes provinces. Les livraisons de vaccins de Moderna, quantité restante des allocations de la semaine dernière, sont également en cours. Et nous avons reçu l'allocation de cette semaine, qui est de 1,4 million de doses aujourd'hui, que nous distribuerons dans les prochains jours et au début de la semaine prochaine. Par la suite, nous continuons de s'entendre à recevoir les allocations de Pfizer-BioNTech pour le mois de juillet, qui totalise 9,1 millions de doses. Et nous travaillons avec Moderna pour obtenir une confirmation du calendrier de livraison pour le reste des allocations du mois de juillet. Ce n'est pas encore terminé. Nous surveillons de près l'approvisionnement à venir pour nous assurer que les Canadiens et les Canadiennes ont accès aux doses nécessaires pour optimiser les taux de vaccination pour toutes les populations admissibles. Merci. Miigwech.
Thank you very much, General Brodie. So, Jean-Sébastien, à vous maintenant. Ça nous fera plaisir, évidemment, de prendre des questions.
Merci beaucoup, Monsieur le ministre. Thank you, Minister. Donc, tel que mentionné, nous allons maintenant débuter la période de questions. Ministers, doctors, and the Brigadier-General will now be happy to take your questions. As usual, it will be one question and one follow-up. Comme d'habitude, ça va être une question et un suivi par journaliste. And I will now pass it over to the operator for the first question. Je vais maintenant passer la parole à l'opérateur pour la première question.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Mia Rapson, The Canadian Press. Please go ahead. À vous la parole.
Yeah, good morning. Dr. Tam, my first question is for you about mask wearing. I'm just curious, I think you had said that when about 75% of Canadians were fully vaccinated, that's when we could start to think about relaxing things like masks and physical distancing. But we've seen more recently calls in England and in Israel, I'm thinking specifically, to continue masks or bringing back mask mandates because of sort of a resurgence in cases. What do you think the Delta variant means for mask wearing, and how long do you think Canadians could expect to need masks or be suggested to wear masks?
Yes, thank you for that question. And of course, we're learning about variants and viruses every day, and certainly the experience in other countries do help inform us. Last Friday, I also showed some new modeling that included, amongst other things, the parameters of the Delta variant in terms of transmissibility and potential for increased impact on hospitalizations. And there we suggest that we could prevent the fourth wave if we can get the vaccine coverage even higher, and including 80% vaccine coverage in the younger adult populations to try and reduce the transmission. So I think it's a combination of things in terms of about mask wearing. And I think we do have to be quite cautious because the provinces are just beginning to open up, and we will then see what happens. Even though we have a good first dose coverage, we still need to, I think, go a bit higher. And quite a number of people haven't had the full vaccination. So this is a period, I think, that we should be more cautious. Having said that, I think that has reduced, you've seen the combination of public health measures and the vaccines reducing the impact in our communities. As things ease up, we just have to watch very carefully on what transmission looks like. At the same time, people wanted some guidance as a rule of thumb, if you like, a framework to work with for individuals who've been fully vaccinated. And we provide some of that on Friday. But still, I think in terms of being precautionary, still think about those fundamental principles of reducing your risk and where risk could be higher. For example, the 3 C's we keep talking about, things: close contact, confined, crowded spaces. Try to reduce all of those things still. We're still not quite there with vaccination coverage, and this is a period of prudence, but I hope the guidance provides some measure of yardstick for people to look at the individual situation. And I keep saying that, life after vaccination guidance is not the same for everyone everywhere. And it's not the same here in Manitoba or the Yukon right now compared to maybe in the Atlantic provinces. So you do have to still follow local public health advice.
Okay, thanks. I'm sort of more talking about whether mask mandates were needed, but my second question is for Brigadier General Brodie. You mentioned an inventory management approach to vaccines. I'm wondering if you could provide a little bit more information about what that means if you're holding back significant portions of all vaccines. I know last week you'd mentioned AstraZeneca being held in back sort of for distribution as provinces requested them. Just looking for a bit more explanation of what that inventory management approach is and how many doses Ottawa is keeping aside.
At this point, we're not holding doses on behalf of the provinces as part of a federal allocation. What we're doing is assisting the provinces in managing their inventory based on their per capita allocations as confirmed shipments come in. And as over the last several weeks, as we have brought more and more significant volumes of vaccine in, we have partnered with the provinces in some cases to help manage their inventory by giving them the option of drawing their allocations down in full or in part as they move through the weeks and support their individual campaigns and programs. We have brought in 795,000 doses of AstraZeneca in the last couple of weeks. Some of those doses were allocated for the provinces based on requirements that they had identified, and a small portion is being held within our federal inventory to offset any requirements as they evolve. So certainly the situation is evolving on a day-to-day basis. We continue to bring in vaccines to ensure that we have the sufficient quantity and types of vaccines that Canadians need in order to continue our vaccination campaigns. With confirmed deliveries alone, we expect that by the end of July, we will have sufficient vaccine supply to vaccinate upwards of 90% of the eligible population, and that is tremendously good news. And as we track closer and closer to those optimal levels of doses, we'll further refine our inventory management approach to ensure that Canadians have all the doses that they require now and going into the future, and that we're well postured for next steps. Thank you.
Thank you, Brigadier General. Opératrice, à vous pour la prochaine question. Operator, over to you for the next question.
Thank you. Merci. The next question is from, la prochaine question est de David Schickman, le CBC News. Please go ahead. À vous la parole.
Yes. Hello, everyone. We have a story up about the Johnson & Johnson vaccine on cdc.ca. Basically, we don't know when we're getting any new shipments. So I guess this question is for Dr. Tam and potentially for Minister Anand. What concern do you have about not receiving any of this one-shot dose? I know we're receiving lots of other vaccines, but this vaccine, the J&J vaccine in particular, was counted on as being, this great help to vulnerable populations here in Canada who might not come back for their second dose. So, what concern do you have about not receiving, any update on when we're going to be getting these doses?
I'll start. Thank you so much for the question. So last summer, we put in place a diverse portfolio of vaccines with leading vaccine manufacturers on the advice of the Vaccine Task Force and the Public Health Agency of Canada, and J&J was one of those companies. We signed an agreement with J&J for 10 million doses of the single-shot vaccine. And that contract remains in place and will be able to lead to additional deliveries of the J&J vaccine to Canada should the provinces and territories need or require that vaccine. At the current time, there are discussions ongoing with the provinces and territories regarding their desire to receive the vaccine. In other words, there's an assessment of demand that is occurring, and there's a conversation between the federal government and the provinces and territories on that point. So decisions are still being made regarding the J&J vaccine deliveries, but by all means, that contract is still in place and still able to yield vaccines for Canadians if the demand is there. I will just add that the numbers of vaccines and vaccinations in this country at the current time are high. 44 million doses of vaccine have been delivered. 36 million doses have been administered. 77% of eligible Canadians have had at least one dose, and over 30% of Canadians are fully vaccinated. We're first in the G20 for the share of the population with one dose. This is on the basis of 2 mRNA vaccines, Pfizer and Moderna. To be clear, we have procured 51 million doses of Pfizer, 44 million doses of Moderna, as well as AstraZeneca. But as I said at the beginning of my response, the J&J contract remains in place, and if the demand is there for that vaccine, we will be able to supply the provinces and territories with it. I'll turn it over to Major Brigadier-General Brodie to supplement my answer in case she has anything on the terms of the negotiations with the provinces and territories. Thank you.
Thank you, Minister. At this point in time, we are not receiving a strong demand signal at all from the provinces, so we continue to leave those communication channels open. If we do receive a signal from the provinces indicating demand, then we certainly have the mechanisms, as Minister Anand indicated, to bring that vaccine in. At this point in time, we are focused on the mRNA vaccines, which are those that are really in demand by the provinces in order to accelerate those second dose strategies and to really get as many first doses as we can as soon as possible. So at this point in time, the demand is really focused on the mRNA vaccines. Thank you, Minister.
Follow-up, David?
Yes. So this is a totally different question, and it's for Minister LeBlanc. So, Minister, the LGBTQ plus community, we're counting on the government to pass the conversion therapy bill. The Senate rises today. People are worried the legislation won't make it through the upper chamber. So I guess the question to you is, what does this say about how seriously the Liberals are taking this issue? Are you worried the legislation won't pass? Why have we gotten to this, 12-hour situation where this really important legislation that's really important to the LGBTQ plus community might not get passed? It's in limbo, essentially.
So first of all, we certainly understand the importance of this legislation. Liberals and the government introduced this bill precisely because we recognize the importance and accept the importance that the LGBTQ community has shown for this legislative action as well. I would have you note that 62 Conservative members of Parliament in the House of Commons voted against the legislation. We believe that the Senate should study this legislation and should adopt this legislation. We're calling on the Senate to do what is necessary to bring this legislation to royal assent. We've also taken note of a number of conservative senators who have resisted supporting this type of legislative amendment in the past, and we certainly hope the conservatives in the Senate aren't going to frustrate the clear will of the majority of elected representatives in the House of Commons and certainly the Liberal government to pass this legislation. So I'll continue to work with my colleagues, the Minister of Justice and our representative in the Senate to impress upon the Senate the importance of bringing this legislation to royal assent. So we understand the concerns of the LGBTQ community. We are of the same view that they are. And we regret that so many conservatives oppose this legislation, but we're certainly not going to give up until it receives royal assent.
Thank you, Minister. Operator, next question. Opératrice, prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Catherine Lévesque, La Presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour à vous tous. En fait, M. Leblanc, je me permets de vous poser environ la même question, mais surtout en voulant savoir comment est-ce que vous vous attendez à ce que le Sénat passe 4 projets de loi assez importants en quelques heures, et ce, alors que ces projets de loi ont quand même été adoptés à la Chambre des communes à la 11e heure la semaine dernière.
Écoutez, nous reconnaissons l'obligation du Sénat de faire son travail. Cependant, le fait que ces projets de loi ont été adoptés à la dernière heure est en très grande partie à cause des tactiques de l'obstruction des conservateurs à la Chambre des communes. Des conservateurs ont, depuis des semaines à la Chambre des communes, utilisé toutes sortes de manœuvres procédurales pour empêcher la Chambre des communes à se prononcer et à voter sur des projets de loi. Alors, c'est en très grande partie la faute des conservateurs si on a été obligé de forcer à la dernière minute avec des séances prolongées, et avec l'appui, il faut dire, dans certains cas, du Bloc et des NPD. C'est la seule façon que nous avons pu ultimement amener ces projets de loi, comme par exemple la thérapie de conversion ou les amendements, le projet de loi C10, tellement appuyé par des communautés artistiques et culturelles au Québec et partout au Canada. Il fallait des alliés à la Chambre des communes, c'est ça que nous avons fait. Et nous espérons que le Sénat va prendre ses responsabilités. Il n'y a pas de magique à dire que le Sénat ne devra pas siéger au mois de juillet. Nous pensons que c'est des projets de loi importants. Ça représente la volonté des députés à la Chambre des communes, dûment élus à la Chambre des communes. Alors, nous allons continuer de travailler avec le Sénat afin qu'on puisse amener ces projets de loi à une sanction royale.
Merci. Je voulais aussi vous entendre sur, en fait, une annonce là, que le chef conservateur Erin O'Toole a fait aujourd'hui. Dans le fond, il promet que, bon, si son parti est porté au pouvoir aux prochaines élections, dans le fond, les conservateurs promettent d'instaurer un plan de préparation d'urgence pour la COVID-19, mais aussi pour toutes les futures pandémies. Si je résume, ils veulent, établir des partenariats avec les sociétés pharmaceutiques pour la fabrication de médicaments. Ils veulent travailler avec les États-Unis pour renforcer la chaîne d'approvisionnement nord-américaine. Ils veulent aussi une enquête publique sur la réponse du gouvernement à la pandémie. Je me demandais si vous aviez peut-être une réaction là-dessus, soit sur M. Leblanc ou Mme Anand. Merci.
Peut-être je pourrais débuter. Et si Anita veut ajouter quelque chose, ce sera parfait. Nous sommes contents que M. O'Toole arrive aux mêmes conclusions que notre gouvernement. Nous avons reconnu depuis le début de la pandémie que le Canada était dans une situation difficile à cause du fait qu'au fil de plusieurs décennies, la capacité de biomanufacturiers au Canada a été énormément diminuée. Mon collègue, le ministre François-Philippe Champagne, avant lui, le ministre Baines, et tout le gouvernement est focusé. D'ailleurs, nous avons annoncé à plusieurs reprises des projets importants au fil des centaines de millions de dollars avec l'industrie pharmaceutique et nous avons d'autres bonnes nouvelles dans les prochaines semaines, précisément pour s'assurer que le Canada soit prêt dans l'éventualité d'une future pandémie. Et ce n'est pas seulement la question de vaccins ou de médicaments thérapeutiques. On a vu aussi avec l'équipement de protection personnelle. Ma collègue Anita a travaillé très fort dans les premiers mois de la pandémie pour s'assurer précisément que le Canada était équipé, que ce soit le gouvernement fédéral ou les provinces. Nous n'étions pas suffisamment robustes en termes de protection. Alors, on va s'assurer comme gouvernement national qu'on ne sera jamais de nouveau dans cette situation. Et le premier ministre et la ministre de la Santé ont aussi indiqué quand la pandémie sera terminée, nous allons évidemment prendre le temps nécessaire d'avoir une révision, une revue de qu'est-ce qui a bien fonctionné, qu'est-ce qui aurait pu mieux fonctionner et donner au futur gouvernement canadien toutes les réponses nécessaires pour protéger les Canadiens. Alors, M. O'Toole arrive à la conclusion des mois et des mois après que notre gouvernement, nous avons conclu exactement la même chose, qu'on a une obligation de s'assurer qu'on sera énormément mieux préparé si jamais on se trouve dans les mêmes situations. Mais peut-être Anita ou quelqu'un voudrait ajouter quelque chose.
Oui, oui, merci beaucoup, Dom. Bien sûr, lorsque cette pandémie a commencé, le Canada ne disposait d'aucune capacité de bioproduction convenant à un vaccin COVID-19. Le sous-investissement dans la capacité de production de vaccins a commencé il y a des décennies au siècle précédent. Nous avons tout de suite compris que nous devions investir, comme Dom a dit, dans notre production domestique flexible et augmenter nos installations, ce que nous avons fait. Notre gouvernement a déjà investi de manière agressive dans de nouvelles capacités de biofabrication. En fait, nous avons pris des mesures sérieuses sur ce front avant la pandémie et dans notre premier mandat, nous avons rétabli la capacité d'investir dans les sciences de la vie. Et nous n'avons fait que accélérer nos investissements de manière significative depuis la pandémie, avec des investissements majeurs dans les capacités de production telles que Medicago, par exemple, et au Conseil national de la recherche. C'est pourquoi le budget de 2021 prévoit 2,2 milliards de dollars sur 7 ans pour assurer la croissance du secteur national dynamique de la biofabrication et des sciences de la vie qui soutient des milliers de bons emplois pour la classe moyenne. Les conservateurs ont y voté contre cet investissement. Ces investissements aideront à constituer le bassin de talents et les systèmes de recherche du Canada et à soutenir la croissance des entreprises canadiennes du secteur des sciences de la vie. And I will say that in addition to all of these commitments to domestic manufacturing, at the same time, we are pulling in record numbers of vaccines such that Canada is atop of the world in the administration of first doses. We've delivered 44 million vaccines to provinces and territories, 36 million of which have been administered. So our strategy is twofold: to build up domestic biomanufacturing on the one hand, and to bring in deliveries of vaccines for Canadians in record numbers. And we will continue to operate on these two tracks so that Canadians are well served, so that Canadian jobs are well served, and so that Canadian sciences are well served. Thank you.
Thank you, Minister Anand. Operator, next question. Opératrice, prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Sarah Turnbull, CTV News. Please go ahead. À vous la parole.
Hi there. Thanks for taking our questions. This one is for Dr. Tam. There's increasing speculation that a federal election could be called this summer or fall. Has the Prime Minister consulted you on how to campaign safely? And do you think Canada is in a safe enough place with COVID-19 to have a national campaign?
No, I have not been consulted on this matter. But we do have already published guidance on the type of public health measures that should be observed. And of course, the Chief Electoral Officer will take some of the those considerations in mind as they go about operationalizing any kind of election. So that kind of dialogue has been taking place throughout, the pandemic itself, really just to make sure people understand the guidance. And but in the end, of course, you also have to take into account what's happening locally at the time. So even now, as I said, Manitoba might be a bit different from Ontario, and maybe even within Ontario, there's different epidemiology. So local public health has to engage with the teams from the Chief Electoral Officer and Elections Canada. I think that's where the engagement occurs.
Okay, thank you. And I think for Dr. Tam as well, the new border changes are set to come into place on July 5th in just a few days. Is there any more information you can provide on sort of the privacy component, or how are you going to ensure there's the security of travelers' vaccination documentation on the ArriveCan app? Has there been any consultation with the Privacy Commissioner on this? Are you concerned about the privacy element? That kind of thing.
Yes, thank you for that question. And if needed, some follow-up can be done with the teams that actually work on ArriveCan. But as with any of these key initiatives, the proper consultations have been done. So that does involve the collection of information with the ArriveCan, including vaccination. And I think is essentially mandatory to use ArriveCan, but obviously whether you upload any vaccination information is also up to the individual as well. And so I think there's checks and balances in all of that process. But yes, I could certainly refer you to colleagues who actually work on the app. But based on what I know, these consultations were done. And I'm not sure if Minister LeBlanc actually has any more information on that front.
Thank you, Dr. Tam. And obviously, our colleagues at the Canadian Border Security Agency take the privacy concerns of Canadians very seriously. One of the things that our government wants to do in terms of developing, in partnership with the provinces and territories, the appropriate proof of vaccination credential for international travel is precisely to ensure the security and privacy of the personal health information of Canadians. We obviously have confidence in the ArriveCan app to date, but it is but a transitional measure until we get to a longer-term international proof of vaccine credential. And the appropriate authorities, obviously working with provinces and territories as well that share these same concerns, will be in touch with the Privacy Commissioner and others to ensure as we develop these options that we're respecting the privacy rights of Canadians.
Thank you, Minister. Opératrice, prochaine question. Operator, next question.
Thank you. Merci. The next question is from. La prochaine question est de Mylène Crête, Le Devoir. Please go ahead. À vous la parole.
Bonjour. J'aimerais revenir sur la question qui avait été posée au début par ma collègue Mia Rabson. C'était concernant le port du masque à la lumière là, de l'arrivée potentielle du Delta variant au Canada, ou en tout cas d'une plus grande multiplication des cas. Donc, je me demandais, est-ce que vous considérez qu'il serait pertinent de conserver le port obligatoire du masque en attente de la 4e vague et peut-être même probablement pendant?
Excusez-moi. Merci pour la question. C'est Dr. Njoo. Peut-être je peux commencer avec une réponse. Oui, on suit étroitement la situation ici au Canada, mais aussi à travers le monde et aussi avec l'expérience dans les autres pays en concernant les variants préoccupants, incluant le variant Delta. Et ce qu'on voit, c'est sûr que le variant Delta est plus transmissible, aussi peut avoir les conséquences plus graves si on est infecté avec le virus. Ici au Canada, à l'heure actuelle, les nombres de cas signalés par jour, mais aussi l'impact sur le système de soins de santé, on est dans une bonne place, mais c'est sûr qu'il ne faut pas assouplir les mesures de santé publique trop rapidement. Donc, je pense qu'avec nos collègues des provinces et territoires, tout le monde sait exactement qu'est-ce qui peut arriver. Donc, je pense qu'avec l'assouplissement des mesures de santé publique, on voit qu'est-ce qui se passe dans les provinces et territoires. On est dans une position de donner des conseils à monsieur, madame, tout le monde, même nous autres ici à l'échelle fédérale, avec des conseils. Qu'est-ce qu'on peut faire si on est vacciné avec les 2 doses de vaccin? Qu'est-ce qu'on peut faire avec nos amis, notre famille? Mais avec ce qui se passe, et c'est toujours important de souligner le point qu'il faut augmenter la couverture vaccinale parce que le plus grand nombre de Canadiens protégés contre la COVID-19 en général, mais aussi contre le variant, c'est toujours mieux pour les pays. Mais on voit qu'est-ce qui se passe dans les autres pays et c'est sûr que si on continue à suivre étroitement la situation épidémiologique au Canada et on commence, je pense, peut-être une région à l'échelle locale ou peut-être dans une province ou territoire individuel, une augmentation, les indicateurs nous démontrent que peut-être le variant de Delta ou les autres variants préoccupants commencent à avoir plus d'un impact. C'est sûr que les autorités de santé publique, peut-être à l'échelle locale ou peut-être à l'échelle provinciale, peuvent toujours mettre en place les autres mesures de santé publique, peut-être, le port de masque obligatoire dans certaines circonstances. Merci.
Ma deuxième question, je me demandais à quoi est-ce qu'on peut s'attendre à l'automne pour les enfants de 12 ans et moins. Est-ce qu'on pourra les vacciner? Est-ce qu'ils seront, encore une fois, un vecteur de transmission potentiel du variant?
C'est Dr. Njoo encore. Merci pour la question. Ce que je peux dire, c'est à l'heure actuelle, on n'a pas, comme dit, un vaccin approuvé pour les enfants de moins de 12 ans. C'est quelque chose que je pense que les essais cliniques sont en train encore de se dérouler. Et on attend, comme on dit, une soumission peut-être à Santé Canada. C'est qu'est-ce qui se passe dans plusieurs pays, mais pour la question, qu'est-ce qui va se passer en automne? Je pense que c'est toujours une question de regarder c'est quoi la situation épidémiologique, comme on dit, en automne. Je pense en général dans une communauté. C'est sûr que les enfants peuvent encore, comme on dit, même aujourd'hui, peuvent encore, comment dire, être infectés avec le virus et aussi peut-être transmettre aux autres, mais en général, ils ont des conséquences moins graves que les adultes. Donc, je pense que c'est pas vraiment nécessairement une question d'enjeu de les maladies parmi les enfants, mais plus la question de transmission aux autres. Et c'est pourquoi on souligne le point avec la population admissible. À l'heure actuelle, c'est très important d'augmenter le taux de vaccination pour voir vraiment, comme on dit, une couverture vaccinale le plus haut possible. Moi, je rêve d'une couverture vaccinale de 100% pour les 2 doses de vaccin. Et si toutes les personnes admissibles sont protégées, c'est moins un enjeu avec les enfants de moins de 12 ans qui ne sont pas à l'heure actuelle admissibles pour la vaccination. Mais on continue à suivre les données probantes, aussi les résultats des essais cliniques et aussi qu'est-ce qui va se passer peut-être avec peut-être une soumission pour avoir un vaccin approuvé.
Merci.
Merci, Dr. Njoo. Donc, opératrice, à vous pour la dernière question. Operator, over to you for the last question.
Thank you. Merci. The last question is from, la dernière question est de Brian Mullen, Global News. Please go ahead. À vous la parole.
Good afternoon. This question is for the doctors. The Royal Society released a report today estimating that 6,000 COVID-19 deaths for people aged 45 and older are unaccounted for in official statistics. That could mean about 2/3 of the death toll may have been missed. Wanted to get your reaction to that report.
Yes, maybe I will start. So I think this is an important report, and it also goes alongside some of the statistics Canada look at excess mortality. We do know that based on some of the ascertainment of cases and also deaths, that some of these could indeed have been missed or are delayed in reporting. So I think that some of these studies will shed further light on the actual impact of COVID-19. And so I think both this report and the Statistics Canada reports on excess mortality will give us a better picture. Which ought to say is that it's even more important than ever to keep up with the vaccinations. One thing that I was really struck by when the vaccines first rolled out, particularly in seniors, not just in long-term care, but then obviously in the community, was how incredibly effective the vaccines were, because we saw the numbers of cases, but also the serious outcomes decline very quickly in those populations. If you imagine this third wave without the vaccine, the mortality impact would have been much higher. You see the deaths didn't rise as fast as the cases. What we saw this time around was actually an increase in ICU admissions and hospitalizations. But the older, more high-risk populations, I think, saw the impact of the vaccines. But those are important studies, because we need to use it for planning purposes, but also for, how do we enhance our data and reporting systems going forwards as well.
On that, how important is it to get better reporting on deaths in Canada, and what are some of the challenges with keeping records of elderly Canadians living in the community outside of long-term care homes?
Yes, I think the provinces and territories that are reporting the cases have really stepped up in this pandemic, and then we had to, come back together and say, well, there's more data fields that we need to have put in. Some of the individual case reporting lags the death reporting, because that takes longer to add to the database, and sometimes they're incomplete. So that's one area I think that we need to improve on. vital statistics, really does take quite a long time to come through. The official vital statistics and going to Statistics Canada, for example. So we do need the more real-time estimates, as well as, of course, the formalized reporting later on as well. But I do think that real-time mortality reporting alongside the other indicators are really quite critical to any future responses, both in the community and in the different outbreak settings as well.
It's Dr. Njoo. The only additional point I would add is that I think you've raised a very important issue, the critical nature of accurate vital statistics, including deaths. And even before COVID, it's always been, I think, a bit of an issue and a challenge because how a death certificate's filled out, could be seen as a, quote, a mundane task. But, especially if someone dies and has multiple conditions, how that, I think, the physician fills out the death certificate with, quote, what is the, main, cause of death, or what are the underlying contributing factors, how that's filled out. That's what gets recorded and get collected as our vital statistics. So I think it just underscores the importance, and I think it's just something that all of us who are involved in that process, I think, appreciate now more than ever. And obviously, it's something to keep in mind as we continue to strive to do better, from the ground up in terms of the initial collecting or filling out of those death certificates, the data, how it's then collected, rolled up at a provincial level, and then obviously going to Statistics Canada and the subsequent analysis for, as Dr. Tam said, planning purposes, evaluation purposes, etc. Thank you.
Yeah, and just to add that there is the Pan-Canadian Health Data Strategy, and I'm sure that we really appreciate the work of the External Advisory Group, but Dr. Vivek Goel has done some recent interviews on that, and that the fundamental objective of that strategy is to help us all improve at every level, and all the different data providers, how we can do better in the future.
Thank you.
Thank you, Dr. Tam and Dr. Njoo. Merci. Donc voilà qui met fin à cette conférence de presse. That marks the end of the press conference. Merci. Thank you.
Merci. Thank you very much.
Au revoir.